Hi everyone. Our group is going to present about the type 1 diabetes in children. My group mates are Tiffany, Q, May, Marley, and Sanchi, and I'm Patricia. So, what is type 1 diabetes? Type 1 diabetes has a strong genetic component, but not all individuals with genetic predisposition develop the disease. So it is an autoimmune disorder in which the body's immune system mistakenly attacks insulin producing beta cells in the pancreas, leading to absolute insulin deficiency. In children, the onset of type 1 diabetes is typically characterized by a rapid progression of symptoms, often following a viral infection or genetic disposition. So, what are the causes of it? The causes of type 1 diabetes are genetic factors like family histories. It can also be viral infections such as enteroviruses and rubella. It may trigger an autoimmune response in genetically susceptible children, leading to the immune system mistakenly attacking insulin producing cells. The condition is more prevalent in children under 15 years old and occurs more frequently in those of European descent, with loss of immune tolerance contributing to disease progressions. So, what are the signs and symptoms of type 1 diabetes? These are the three P's: the polydipsia, which is the increased thirst, polyuria, which is the frequent urination, polyphagia, which is the increased hunger, which result from high blood sugar and insulin deficiency. Children may also experience unexplained weight loss, fatigue, blurred vision, and mood changes.
Hi everyone, my name is Sandri. So I'm going to be talking about treatments. First, the treatments for type 1 diabetes in children includes monitoring blood sugar, exercising regularly, eating healthy foods, taking insulin. Um, Insulin for children with type 1 diabetes. Children with type 1 diabetes need insulin for life because their bodies can't make it on their own. Insulin helps control blood sugar levels and keep them healthy. There are different types of insulin, each working at different speeds. Rapid or fasting acting insulin starts with working in about 15 minutes, peaks after an hour, and lasts about 4 hours. It's usually taken before meals to help with manage the blood sugar during eating. As well with shorting acting insulin works a bit slower, starting in 30 minutes, peaking after 90 to 120 minutes and lasting 4 to 6 hours. Is sometimes called regular insulin. Intermediate acting insulin, also known as NPH insulin, this type kicks in after 1 to 3 hours, peaks around to 6 to 8 hours, and lasts 12 hours to 24 hours. It helps keep blood sugar steady between meals. And lastly, with the other ones is long and acting insulin provides steady blood sugar control for a long time, sometimes up to 40 hours. This type helps keep level balance throughout the day and night. Each child's insulin plan is different, and doctors choose the right combination based on their needs. Managing diabetes with insulin is all about finding the right balance to keep the blood sugar stable. Lastly, insulin delivery options. Children with diabetes need insulin every day, but there are different ways to get it. There's a needle and syringe. This works like a regular shot, but with a smaller, thinner needle to make it more comfortable. Insulin pen. This looks like a regular pen, but instead of ink, it holds insulin. A tiny needle is attached for easy injection. An insulin pump, a small device worn on the body that gives insulin automatically throughout the day, and it connects to a thin tube that goes under the skin, usually in the belly. Each method helps keep blood sugar under control, and the right option depends on what works best for the child.
Hello, so my name is Marley. I'll be talking about the next slide. I'll be going over lab diagnostic studies, random blood sugar test, a blood sugar test of 200 or higher, along with symptoms like increased thirst or frequent urination, suggests diabetes. Glycated hemoglobin test, which is the A1C test. This measures average blood sugar levels over the past 2 to 3 months. An A1C level of 6.5 or higher on two separate tests indicate diabetes as well. Fasting blood sugar test. A blood sample is taken after fasting for at least 8 hours. A fasting blood sugar level of 126 or higher suggests diabetes. Another test is an auto antibody test. These tests check for specific antibodies that are common in type 1 diabetes, helping to distinguish it from type 2 diabetes. A C peptide test. This measures the level of insulin production and helps confirm type 1 diabetes. For the next slide, the lab test for stable type 1 diabetes. For children with type 1 diabetes who are more stable, the focus shifts from diagnostic tests to monitoring and management. Here are some tests and tools commonly used in such cases: continuous glucose monitoring, blood glucose monitoring, important to ensure glucose levels remain within the target range. Urine ketone testings, while less frequent for stable patients, this test can be used during illness or stress to check for DKA, which is diabetic ketoacidosis. Lipid profile and kidney function tests. These are periodically done to monitor for complications and ensure overall health. And the one of the last tests is antibody testing. In some cases, antibody levels may be monitored to understand the progression of autoimmune activities.
Hi, my name is May, and for nursing intervention, monitor blood glucose levels, check blood glucose levels before meals and bedtime or as ordered, and monitor for signs and hypoglycemia and hyperglycemia, assess for hypoglycemia, sweating, shakiness, irritability, confusion, headache, and then for and assess for hyperglycemia, thirst, frequent urination, fatigue, and fruity breath, and provide nutritional education, teach balanced diet and carbohydrate counting, encourage consistent meal and snack timing, collaborate with dietitian for individualized meal plan, and encourage physical activity, support age appropriate exercise with proper planning, educate the child and family, demonstrate insulin administration techniques, discuss signs of hypo and hyperglycemia and management. And last one is psychosocial support, offer emotional support and reassurance, involve child in care decision to build confidence, and the last one is refer to counseling or diabetes support groups if needed.
Okay, my name is Q, and I'm going to be understanding type 1 diabetes. Here's some key points. Type 1 diabetes is an autoimmune condition when the pancreas stops producing insulin. It is not caused by diet or lifestyle, and it can't be prevented. Symptoms include excessive thirst, frequent urination, weight loss, fatigue, and irritability. Management involves insulin therapy, blood sugar monitoring, and a balanced diet. Parents play a key role in helping the child manage type 1 diabetes.
All right. Hi, I am Tiffany, and I have a true story about Campbell. So, this patient, Campbell, was a healthy, energetic 2 year old when his parents began noticing something wasn't right. He was sleeping more than usual, drinking an unusual amount of fluids, and consistently needing to use the bathroom. He also had stomach pains and was losing weight. I can't see that. Sorry. Subtle but concerning changes his mother Mary couldn't ignore. So when 2-year-old Campbell started showing unusual symptoms. His mother sought medical help at her local children's hospital of Philadelphia at their primary care office. After testing, the medical team sent Campbell for emergency treatment of type 1 diabetes. Thanks to their swift action, Campbell received life-saving care just in time. Today, he's a happy 4-year-old, and he's with his family, and they're forever grateful. So it's a good thing that we act quick because kids decline quicker than us adults. And that's it.